Okay, we know that behaviors, when they are repeated over time, it forms a kind of pattern or regularities. These patterns or regularities of behaviors give us some sort of stability, and this makes the behavior predictable. So this is how social structure is being formed when behaviors between teachers and students, they are repeated day in day out, every week, every month, within a semester, within a school year. Students are going to be able to predict what the teacher is going to do. We all know that. Students will know. Teachers will not teach right away at the beginning of class. Teachers will do housekeeping. They will ask questions on previous assignments. They will do other housekeeping stuff. They will remind students of other due dates, and so on. And these behavior before the lessons start are predictable. Students know. Teachers will not teach right away. After housekeeping, maybe teachers are going to teach. And after teaching, maybe teachers will give assignments. And all these interactions or behavior that takes place in the classroom, when they are repeated, they form a pattern, and because of that, it gives the behaviors or the interaction between teacher and student some sort of stability. All this is going to make the behaviors or the type of interaction predictable. This is how social structure is being formed. As you can see from the diagram above. It is the same thing with doctor-patient interaction. We know that when the patient goes to see the doctor, the behaviors are predictable too. As soon as the patient enters the waiting room, waiting to be seen by the physician, all these behavioral patterns are predictable, as we can see. As soon as the doctor comes in, the doctor may have some small chat with the patient. The doctor may not give diagnosis or treatment right away. The doctor may spend a few minutes having some small chats to ease up the situation, maybe. And the doctor may then start giving diagnosis, prognosis, or treatment suggestions. Then after that, the patient is going to know that before the doctor send him or her out from the room, the doctor may give prescription, may send him or her to another place. So, as you can see, behavioral patterns pertaining to doctor-patient interaction are also predictable. These behaviors are repeated across different patients or across similar patients when they go for follow-ups. So there's a repetition associated with doctor-patient interaction, and this repetition in doctor-patient interaction is going to form some kind of pattern and regularities, which give this type of interaction some kind of stability, because patients and doctors will know what to predict in their next visit, in their next follow-up. However, COVID-19, as we all know, is going to change the nature of all these behavioral patterns. So, Before COVID, teacher, when they interact with students, nobody wears a mask, and now everybody wears a mask. Okay. Even though there's still some repetition associated with teacher-student interaction, this repetition will still form a pattern, will still form some regularities, will still give some stability to that interaction, to that behavioral pattern. But now, maybe before class start, teacher may give every student an alcohol wipe, and students and teachers are required to wipe their desks, their chairs, or even the vicinity of the classroom for the teacher before they start the lesson. So, as you can see, COVID is going to change the behavioral patterns of teacher-student interaction. They are required to clean things up before starting a lesson, both teachers and students. And teachers may also be required to give students a mask if they don't have one, or if they need to change their mask. Once again, as we can see, this is how COVID can change the regularities of interaction or behavioral patterns between teacher and student interaction. But these behavioral patterns are still going to repeat over time and form a social structure in times to come. These behavioral patterns is still going to give both the student and the teacher some predictability over time, even if they are wearing masks nowadays. And teacher and student may try their best to practice social distancing in the classroom. And they are going to practice social distancing day in, day out, every week, every month, until the end of the school year. This is one way of how COVID can change the social structure with regards to teacher-student interaction. And before COVID, it seems to me that only dentists wear a mask when they perform some procedures to the patients. Usually only certain types of specialists or physicians, they wear a mask when they are performing a surgery or when they are performing extraction or cleaning or filling on the patient. Not all physicians wear a mask when they interact with patients, but after COVID, all physicians, in fact all medical professionals, nurses included, physical therapists included, are going to wear a mask when they interact with patients. And this is not going to change the regularities of the behavior with respect to interaction between medical professionals and the patient. After COVID, everybody wears a mask, and this behavior is still going to repeat over time, and it forms a new pattern. It gives rise to a new regularities and a new stability until it becomes predictable that it is expected for both doctors and patients to wear a mask from now on when they interact with one another. And this is the same thing at the workplace. If there's no option for employees to work remotely, they may wear a mask when they go to work, and they may also be provided with more wipes, and employees, colleagues may clean their workplace before they start work, clean their PCs, clean their laptops before they start work. So the point is, COVID-19 is going to give rise to new patterns and new regularities or new stability to the new repeated behaviors. Now, at the workplace, everybody is going to wear a mask. It's predicted that everybody is going to wipe their desk more often or before work. These behavioral patterns is going to repeat itself day in, day out. It becomes predictable that employees are going to wipe the vicinity of their workplace before they start work, and it is also predictable that employees are going to wear a mask at the workplace when they interact with their colleagues. So these are some of the examples of how COVID-19 changes the social structure.